Hi everyone, welcome back to Life Noggin. Today, we're going to talk about something super important and useful. How to use a pregnancy test properly to get the most accurate results. Whether you're trying to conceive or just checking, knowing how to use the test right can make all the difference. So, let's dive in. Section 1. What is a pregnancy test? First, let's quickly cover what a pregnancy test actually is. A pregnancy test detects a hormone called human chorionic gonadotropin, HCG for short, which your body produces when you watch spay. Re-pregnant. These tests are widely available, easy to use at home, and usually pretty accurate if you follow the instructions correctly. Section 2. When to take a pregnancy test. Timing is everything when it comes to pregnancy tests. Most tests work best if you wait until after your missed period. Testing too early can lead to a false negative because your body might not have produced enough HCG yet. Here are some tips for timing. Wait at least 1 week after your missed period for the most reliable results. Testing early could be inaccurate. If you can't wait, some highly sensitive tests claim they can detect pregnancy even a few days before your period. But remember, early results may be less accurate. For the best results, use your first morning urine because it's usually more concentrated and has higher levels of HCG. Section 3. Types of pregnancy tests. Now, there are 2 main types of pregnancy tests you might come across. Strip tests. These are simple paper strips that you dip into a cup of collected urine. Midstream tests. These allow you to hold the test stick directly in your urine stream. Both work the same way by detecting HCG, but midstream tests are generally more convenient and less messy. Section 4. Step-by-step instructions. Okay, here's the crucial part: how to actually use the test. Step 1. Read the instructions. Every brand can be a little different, so before you start, make sure to carefully read the instructions on your test box. Step 2. Wash your hands with soap and water. Then gather your test, a timer or watch, and a clean cup if you're using a strip test. Step 3. Collect urine. If you're using a strip test, collect your urine in a clean container. For midstream tests, hold the absorbent tip in your urine stream for about 5 to 10 seconds. Don't soak it too long. Step 4. Wait. Lay the test flat and wait for the amount of time specified on the instructions, usually 1 to 5 minutes. This is important because checking too early or too late can affect accuracy. Step 5. Read your results. Most tests show 2 lines or a plus sign for positive. 1 line or a minus sign means negative. Some digital tests will say pregnant or not pregnant directly. If the test doesn't show any lines or words, it might be invalid and you should try again. Section 5. What to do after getting your result. If your test is positive, congratulations! The next step is to make an appointment with your healthcare provider to confirm the pregnancy and start prenatal care. If the test is negative, but you still don't get your period, wait a few days and test again, or see your doctor. Sometimes hormone levels might not be high enough yet, or there could be other reasons for a missed period. Section 6. Common mistakes and tips. Here are some common mistakes to avoid when using a pregnancy test. Don't drink too much water before testing. It can dilute your urine. Don't check results too early or too late. Don't reuse tests or use expired tests. Store tests in a cool, dry place to keep them effective. That's it. Using a pregnancy test is simple once you know the steps and timing. If you found this video helpful, give it a thumbs up and subscribe for more health and pregnancy tips. Got questions or want to share your experience? Drop a comment below. I'd love to hear from you. Thanks for watching and take care. Now that you know how to use a pregnancy test, let's talk about why you might use one and what happens next. If you've recently had unprotected sex and think you might be pregnant, taking a pregnancy test is the first step to confirm whether you are or not. It can be a nerve-wracking time while you're waiting for your test results, but there are ways to help ease your anxiety and prepare for whatever the outcome may be. If the test comes back positive, it's important to schedule a doctor's appointment right away. Your doctor will be able to confirm the pregnancy through a blood test and discuss next steps, which usually involves prenatal care. They'll also answer any questions you might have and provide guidance on how to take care of yourself and the baby throughout the pregnancy. However, if the test comes back negative, it's important to remember that it's not always accurate. False negatives can happen for a number of reasons, such as testing too early, having a very low HCG level, or diluted urine. If your period still hasn't arrived, it might be worth waiting a few days and taking another test. You can also speak to your doctor, who may recommend a blood test to check for HCG levels. If you're not pregnant this time, it's important to remember that it's okay to feel disappointed, but don't get discouraged. There are plenty of resources available to help you understand your options and plan for the future. Whether you're trying to get pregnant right away or want to wait a while before trying again, overall, while a positive pregnancy test can be exciting and a negative one can be disappointing, both outcomes are valuable information that can help you make informed decisions about your sexual and reproductive health. With the right knowledge and support, you'll be able to navigate this journey with confidence. If you found this video helpful, please like and share it with anyone who might benefit from it. We value your support and can't wait to bring you more informative content in the future. Until then, take care.